or wait till after?
Doesn't matter. It's whatever you want.
I think we're good to go, Bill. It's 10:30.
Okay. Good morning, everybody. We're going to start off our first cross-country share for 2025 with Ontario Safety North. The topic is mental health and psychological health and safety in the workplace. We'll start with Jennifer Irwin, who works with WorkSafeBC and is a safety and mental health professional whose career has spanned 17 years. She's focused on heavy industry, including mining, road building, container terminals, and municipal government. So she's got a lot of good experience there. Most recently, she has joined WorkSafeBC as an occupational health and safety consultant and focuses on mental health injury prevention in the workplace. And I guess everybody in BC knows that we have various things that require us to pay attention to this, like regulation. Jennifer holds 2 diplomas and a professional designation, one in occupational health and safety, and the second in counseling with a certificate in life coaching. Jennifer is passionate about mental health and how it is so connected to the health and occupational health and safety, which is true. She looks for opportunities every day to incorporate a safety and mental health wellness mindset from the start of work through to the close of the day. And Jennifer firmly believes that we work to live rather than live to work. And so everyone should go home healthy and safely at the end of each day, which is actually, I think, close to what our motto is at the BC4 Safety Council. So welcome, Jennifer. I'll hand it over to you. And if you want to go ahead.
Yes, thank you. Thanks for the warm welcome. I'm just very happy to be here. So I'm just going to jump right into the slide deck. I just was looking for my speaker notes. There they are. So first of all, I'd like to acknowledge the lands that I am privileged to work, play, and take care of, and they're the ancestral and unceded or treated territory of the Coast Salish peoples, including Musqueam, Tsleil-Waututh, and Tsawwassen First Nations. So that's the south coast of BC for those that aren't in this province. So as Bill mentioned, I'm with the prevention division, and what that means here at WorkSafeBC is that I work with programs prevention services, and my role is primarily to educate, consult. I don't do the enforcement side of the house. So we have an operational priority to make sure that employers and workers in BC understand what's required of them. And that's what makes me so jolly about opportunities like this, because I do get to consult and hopefully do a little educating today. So this is my little team, and actually, Bill, I apologize. I should have updated. We had a change of our title, so we're back to industry program specialist. So anybody that used to work with us would have known us as the CES. So that was just my colleagues and I. So there's 3 of us on the team that are very similar backgrounds to myself, where we combine safety and uh, counseling of some variety. So our major priorities on my team are began with the BC First Responders Mental Health Committee, which has a number of transferable resources that I will speak again at the end of my presentation to that could be used in your industry. We do like to share and show this committee's work through their website because it is so transformational and it has been recognized internationally, so very well worth looking at. We're also very focused on resource development, education and awareness, as I said, employer-worker consultation, so we can be invited into workplaces or into situations like here today, as well as we are connected with multiple health safety associations like Switch BC, BCMSA, etc. So we have a fairly consultative experience, but we are just a small little team, the 3 of us, but do think of ourselves as subject matter experts in the land of psychological health and safety. So what does it all look like? When we think of psychological health and safety, what kinds of terminology do we think of? And so there's a bit of a mind map here, and it's all interchangeable right now. We haven't really landed our lexicon for having a consistent conversation across our country, in the province, and it's beginning to form, which is exciting because it really matters when you're talking about a risk versus a hazard versus mental health versus psychological health and psychological safety. These are all different terminologies. So it's really one of the things that I really wanted to impart after talking with Tammy and Bill today, or leading up to today, was some of the definitions or terminologies that we will be trying to get consistent, or what you may come across as you embark on this work in your workplaces. So psychological safety is a sensation that you can show up authentically, be who you are, speak up when you need to, that you have the ability to ask for support without negative consequences, that there's a decreased sense of stigmatization if you need to say you're on like a track to becoming a supervisor or a member of management, but you're having a challenge and you feel like your promotion may be at jeopardy if you identify that you need support. You know, being psychologically safe means that you can do that without worrying about your career projection. Psychologically healthy and safe workplaces um, create a culture where psychological well-being is protected and promoted. So in the same way that we do that for physical safety with hazard and risk assessments, training, mentorship, orientation for young and new workers, all of those things contribute to a physically healthy and safe workplace. We need to be doing the same kind of mechanisms for psychologically healthy and safe workplaces. Such a tongue twister for me still, I don't know why. And that also means that there's no harm to the worker's mental health in negligent, reckless, or intentional ways. And this kind of whispers to the bullying and harassment and workplace violence pieces. But I also, my most recent municipal government experience, I've only been with WorkSafe for about 15 months. We had some serious incidents, and what I started to see was post-incident, whether there was injury or there was a couple fatalities, unfortunately. What were we doing for the crew or the folks that were involved in the investigation after the incident? Because not everybody responds the same way. And so we needed to change our lens, that it didn't take a fatal or a serious incident. It could have been a significant near miss. It could have been, we did a lot of groundbreaking work and would hit gas lines more often than we should have. And so, what is the new person on the crew experiencing for the first time, and versus the other crew members who have been around that? So I hope some of that might resonate with some of you for the work that you all do. There's ways to consider the impact of an experience at work and plan for it or prepare for it so that you have some prevention there. Well-being at work is on, pardon me, the mental health side on the spectrum. Like, this is about your fulfillment of the physical, mental, social, cognitive needs. So this is our Maslow's hierarchy of needs, right? Like, this is how are we as workers and employers contributing to a culture of fulfillment and safety and connection in the workplace, because anyone who's been on a good team knows that those exist, and that creates well-being at work. So these definitions were drawn and inspired by the CSA standard and the ISO standard. And so I'm going to operate on an assumption that many on the call are familiar with these two standards. So CSA standard has 13 psychosocial factors right now. It's under review and will be updated, I think, before the end of the year. So they're just listed on the screen. I'm not going to walk through them all, but they do have some foundational connection to the terminologies that I was just explaining. And then we also have the ISO standard, which is an internationally recognized standard for psychological health and safety. And it has three categories of psychosocial hazards: the work organization, social factors, and work environment hazardous tasks. So this one is much more performance-based, where the CSA standard is a lot more prescriptive as it's written right now before the updates. So the next terms that I wanted to walk through are some that come from work that we're doing at WorkSafeBC. So we, in a few slides, I'll unpack it more, but we have a mental health strategy and then a framework for success. And within those two documents, we have some conversation around psychosocial factors and psychosocial hazards. So a factor is just a thing in the workplace that is neither negative or positive, but it can have a negative effect on the psychological and physical health. So if there is a lack of design in consideration for biological male and female on a piece of equipment that they're using, there could be a psychosocial factor for the smaller of the two types of physical makeup, trying to use the same piece of equipment and fear, but they may not feel like they can speak up about it. And that would be just a factor around job design or work design. Where the psychosocial hazard is the equipment, like the itself, like it's the experience. So what happens when we're exposed to the hazard, right? So just like physical hazard and risk, there's psychological hazard and risk. And so when a worker is exposed to the hazard, that's when we can see the mental health injury or the psychological injury or disease develop. The third term on the screen is something that we're playing a little bit with at WorkSafeBC. It's not quite adopted, but it's something that in Safe Work Australia is the sort of owner of their health and safety programs for the country, but each jurisdiction in the states and territories have adopted codes of practices that Safe Work Australia has put out. And within that, we have been taking a look at and considering content, and something that my colleagues and I feel really, I'll say, passionate about is the idea that there's barriers that may put some workers at a higher risk of exposure to the psychosocial hazards. And this is things like, do employees or workers understand what's happening or what's the next step? Do they understand what the psychosocial factors or hazards are? Do they know how to prevent it? Do they know how to speak up? And it really comes to create a lens for the employer to consider the individual. That is a question that we've heard quite a bit at presentations. Like, how do we manage as an employer anything that a worker brings with them from home or from their external experiences before they get to work? And so the barriers is one of those terminologies that considers those pieces without needing to be hey, Jennifer, what's your unique individual need? It's really just a way to group some risks that may present from individuals within the workplace. So I don't know if feel like I kind of fumbled that explanation, but it's a new concept that we're playing with, but we're really interested in it. So why now? And I imagine many of you on the call here today can probably already answer it, but here's some numbers for you on the screen. So the top row, the 500,000 Canadians a week unable to work due to their mental health. This one always impacts me when I think about it, look at it, read it, because it hasn't changed, and this data hasn't changed in a very long time. In fact, if anything, it will probably increase because, as we know, with awareness comes increase of reporting and increased numbers. But that is a shocking number of people who feel like they can't do their job because of how they're feeling with in their mental health or emotional health. The cost of it, the $50 billion per year, that's for just to our Canadian economy. That's not globally or anything. That is quite a bit. And I think that the iceberg theory has become a bit boring in physical health and safety, but when we start unpacking numbers like these for the psychological health and safety, the iceberg becomes Titanic size. Like it really, the impact becomes huge. And then the next data point that I want to point out is the bottom right corner. The 71% of employers believe they do a good job where only 27% of their workers agree. So there's a disparity between the culture that employers are trying to create versus what workers are feeling, which then creates a disconnect around the psychological safety in the workplace. So there's some important data points on the screen here, but I imagine many of you are already feeling like this is something that is important and it needs to be done. So I won't spend more time trying to convince you. So this is Dr. Ashley Spetch. She was the lead on a panel of international experts that helped us to design and create our mental health strategy. I won't bore you with the process. I'd rather get into the content, but we do have, she's our chief mental health officer and she's a doctor of psychology. So we have this overview document for the mental health strategy, and essentially what we want to do is to make sure that employers have a sense of where we're going, bring a greater focus on prevention, and engage proactively with workers and employers. So there's 3 principles that the mental health strategy introduces. The first is to show leadership commitment. So this is something we're familiar from a physical health and safety program, and but it isn't just about policy. It's about modeling behaviors, ensuring access to resources, making sure workers know that the resources are there, communicating openly, lead by example, assess job demands. Like, these are all ways that leadership can show commitment to psychological health and safety. The next is developing supportive managers and supervisors. And this is integral because we know that our frontline supervision is the key to implementation and creation of connection for folks when they're working with us and for us. And many studies show, and I sorry, I don't have them to quote, but many studies show that workers will follow supervisors that they feel connected to. They will actually leave a workplace if that supervisor leaves because they want to stay working with someone who makes them feel connected and seen and heard and safe physically and psychologically in the workplace. So by developing supportive managers and supervisors, you're enhancing that experience and increasing your retention, increasing your psychological health and safety culture. And then the third principle is ensuring worker participation. This is a very familiar concept, I would say, across all provinces in our regulation, that we need the participation of our safety committee, we need our participation of our workers, and they are the ones who can create the color for you when you are trying to understand where to start in the painting of your psychological health and safety culture. So being able to voice concerns, offering, receiving peer support is huge. Knowing that you can have a buddy system or a mentor program where someone actually feels safe to speak up if they don't in other ways. Creating time for training and resources. Like, our workers will really tell us the story when we think we've got it. Now, remember that data point that 71% of employers think that they're doing a good job, but only 27% of workers agree with that statement. So ensuring worker participation is monumental. So those are our 3 key principles. And so the definitions and the principles were the 2 things that I wanted to share with you today. And I really sped through it, trying to be mindful of our time together. But I will just zoom through some other pieces. So we have the mental health strategy as a resource, and then we have our framework for success that carries on the 3 principles. And then we begin to introduce risk assessment and mitigation. And that's through looking at the bolted list on the screen here. We've got 5 categories of psychosocial hazards that we've begun to try to support employers in BC to take a look at and understand what the hazard and risks are. So we take a bit of time and we unpack each of those 5 psychosocial hazard categories in our document. So these 2 documents can be found on WorkSafeBC's website, and that I don't see it here. Apologies. It is on our just our general website. I can put the link in the chat when I wrap up my portion today so that you have quick access. But some other important resources, we offer a crisis support line. It's available 24/7, particularly after an incident. So I've mixed myself up. The first one is just the general crisis line. The second one is our critical incident response program. We have our claims call center, and we also have our prevention information line. And then these are some external resources that are available if you're unfamiliar with them at this time. And the 310 mental health support, I believe that is just in BC, but many of the others are across the country. Okay, I think I did that in a tight 20, so I don't know if there's any questions. I wasn't monitoring the chat.
No, that was great, Jennifer. Does anybody have any questions for Jennifer?
There is a question in the chat.
Okay, yeah,
The
there is one
breakdown.
there. It's I don't know if you see that, Jennifer.
I do. Thank you for that question. It's an excellent one. I believe the data comes from Canadian Mental Health Association's work, and I would have to dive into that to see if there is. I can tell you that the data comes from absenteeism reports and anonymous surveys, so that what's happening is many people are calling in sick to work with a headache or the flu, or their kid had to stay home, but really the backstory is that it's related to their mental health. So I don't know if that helps unpack that a little bit, Victor, but I think with a little.
What I was looking for with more industry specifically. I mean, I work in the forest industry. My wife works in the healthcare industry.
Yeah.
I come to work. I've been doing this for so long, with the odd exception to somebody saying, you know what, I'm just a little stressed out. I'm going to stay home today, or whatever the circumstances are. Those are few and far between, as opposed to my wife working in the healthcare industry, where 30 people are supposed to work that day and 25 people don't show up because they're stressed out. That 500,000 people. I'm just trying to get a handle on the effects within my industry.
I would suggest that I have not seen that it's broken down by industry. When I think of the data set, I would also be interested to know within your industry if there is still a stigma for raising your hand to say, like, I need to take a knee because of something going on personally, mentally, emotionally, versus using sick time and giving a different reason. Yeah, that's a really interesting concept, and I don't think that I'm stalling because I'm trying to rack my brain in the dusty, rusty file folders here to see if I've got any immediate access. But I will reach out to Canadian Mental Health Association. I have a couple of good contacts to see if they've done any industry breakdown, and then maybe I'll go through Tammy if I come up empty or come up with a response.
Yeah, I mean, I think we can all agree it's an alarming number, and we want to try to reduce that as much as humanly possible. I'm just trying to get a better understanding of how it's filtering properly.
Yeah. I think,
Thank you.
yeah, I'll have to look into that. Thank you.
Do we have any other questions for Jennifer? So Jennifer, I just wanted to add maybe an experience of mine. I've been in operations management and forest products manufacturing for a long time. Various different management roles in the operations. And about 24 years ago, I was holding the head of a truck driver that fell off his residual truck when he died. And first aid was trying to revive him. You talked about providing services and help to people that are involved in those type of events. It's something I live with every day and what propels me on through my job, and the reason why I went into health and safety, because I wanted to become part of the problem. I mean, part of the solution, not part of the problem. Because at the time I actually took a close look at myself and said, I'm not actually doing a good job when it comes to health and safety. I need to do a better job. So I think it's taken a long time to finally come out with a lot of what you're saying with psychological safety and regulation and creating safe workplaces. It could have been something that came out many, many years ago, but now that we've got it, we should embrace it.
Mhm.
And I think as employers or people that work with employees that are on this call, that start taking some steps towards actively looking at this issue within the workplaces and what we can do differently. You had some great points there, and there's a lot of really good, I think, information coming out of your department at WorkSafeBC.
Thanks.
So it is something that we've embraced in the manufacturing department at BC Forest Safety Council, both with sawmills and pellet operations. So we're out there trying to provide as much education and training as we can on these issues.
Yeah. Thanks for sharing, Bill. I agree. I think COVID, the one gift that it keeps giving that I'm glad for is the conversation about mental health. It really has changed how we talk about it, how we think about it, how we approach it, and I think of the fatal investigation that I was lead on, and saw some things, and you know, you're right. You carry it with you, and it is when you sign up to be a safety professional, there's a likelihood that you're going to see something of that magnitude. But I'll use my personal experience, when you apply to a job to drive a garbage collection vehicle, you don't expect to be on a flusher truck after someone has died by suicide and flushing the street. Like, there's things that our workers see and are exposed to that aren't necessarily in the job description, but it doesn't take away the responsibility as an employer to make sure they're okay. And so where I dug in with my experience was I was very loud about the need for the mental health support, the debriefs, the CISM, the gathering, even up to the executive. Like, these are people who are mourning the loss of a worker, but they still have to keep the rest of the operation going and have to make production decisions and approvals of budget spends while they are in grief. And I think that there is a very big gap when it comes to incident response, because that's kind of where we're at right now. We haven't quite got our claws fixed into the prevention work yet. We're getting there. We're building it. We're wanting it. So we're still in the reactive experience. So within the reactive experience, what can we do differently as employers? And I think focusing on the stigma and developing your supportive managers and supervisors, as if you don't know where to begin, I think those are two places that become really beneficial, and the ripple effect is big. Something as simple as Pink Shirt Day, like, start conversations. But thank you, Bill, for the share, and I agree with you. We all feel like we can do better, but don't forget to look at how well you've done so far.
Thank you. So any more questions for Jennifer? Okay, so thank you very much, Jennifer. I think it was well presented, and you spoke quickly, but there was a lot of information that you got across.
I did. I used to get in trouble as a child for how quick I spoke, but at least I was breathing this time. It usually takes me about 10 minutes to calm down and take a breath as a presenter. In the chat, I've put our link where you'll find pieces from WorkSafeBC, including those 2 documents that I dabbled on. And thank you so much for your time today.
Thanks, Jennifer. And I'm going to hand it over to Chris to introduce your speaker.
All right, thank you, Bill, and thank you, Jennifer, for your presentation. So now I will turn things over to Adrian Allam. So Adrian Allam is a Canadian registered safety professional and a certified psychological health and safety advisor with the Canadian Mental Health Association. Adrian is currently employed with us at Workplace Safety North as a health and safety specialist working out of the Thunder Bay area. Adrian's career spans over 2 decades working in the field of health and safety, predominantly in the forest and manufacturing sectors across BC, Alberta, and Ontario. So Adrian's tenure also includes other functional experience in areas of human resources, disability, and environmental management. She is a well-rounded, seasoned professional who is motivated by her passion for people, their well-being, and giving back to the community. And Adrian is going to provide a high-level overview of the Workplace Safety North Workplace Mental Health a Framework for Leaders program, which she was instrumental in the development of. So I will turn it over to Adrian.
Great, thank you. Thank you, Chris, for that introduction, and thanks everybody for having me speak to you today. So as Chris said, I am going to provide a high-level overview of one of the programs that Workplace Safety North offers. And really for discussion purposes, I've sort of taken some of the slides from the actual program itself, and I'll walk you through some of the content that we discuss as we go through. So the program itself, Workplace Mental Health for Leaders, was developed post mental health awareness or a mental health 101 session, which I'll speak to. It's really designed for managers, supervisors, joint health and safety committee members, wellness leads, and I'll walk you through a bit more of the detail as we get started. So the course objectives for this course, it's to discuss why psychological safety is important at work. We want to bring awareness to recognizing workplace contributors towards psychological health and safety risk factors. We certainly want to raise the profile of the of legislation that pertains to psychological health and safety, and really focus in on the individual responsibility to be familiar with the organizational policies and procedures that and resources that their employer has. We use the RACE concept, recognize, assess, control, and evaluate hazards, and put a little bit of a spin on for psychosocial hazards, where we discuss qualitative and quantitative work demands. And then we really have developed some tools, which I'll give you a little bit of a preview today, to support frontline leaders and workers in navigating resources, including staying at work and returning to work safely and sustainably, and then building a bit of a toolbox. The real large goal of the program is to normalize discussions related to mental health as well. So I'll continue on. The design of the program itself, the program has 8 different modules. It's very interactive. There's a lot of activity built into it, a lot of really great discussion, and we draw on individuals' experience as well. Prior to taking that course, we highly recommend that the individuals take a Mental Health 101 course. That's a course that Workplace Safety North has also developed, and it's a 4-hour course. It really sets the foundation for the mental health for leaders. It does introduce the CSA standard. We talk about the mental health continuum. We learn about stigma, and we introduce the Are You OK conversation model and ALEC, which are derived from the Australian Are You OK campaign. And ALEC is really a simple way to have a meaningful conversation about mental health. As I said, it is an 8-hour full-day training, and the instructors of this particular course are certified under the Canadian Mental Health Association as certified psychological health and safety advisors. The first, as we get into the course, we sort of do a bit of a recap on what we've covered off in our Mental Health 101 session. It was interesting as I was listening to Jennifer speak, and she talked about the differences. And, what we do, and is part of the very introductory part of this course, is we talk about the difference between mental health disorders, and mental health challenges. And often we find that these words are used interchangeably, but they're not the same thing. So we discuss the differences, and we really want to set the stage for the next section. So we pose different questions. We start asking the leaders, what do they believe their role is with respect to psychological health and safety? What types of situations can cause harm at work? And again, we bring back the CSA standard and talk about leading by example in the realm of psychological health and safety. We talk about what it is and what is not, what it is to support workers in the work environment, but it's not guaranteed applause for everything everybody does. So we have some really good dialogue about that. Okay. We then move on to section 3, which is really leading us into workplace dynamics. And it's an interesting discussion because we really start to talk about generations at work. And we discuss how in today's workplace, we have 5 generations at work. It's probably the first time in history this has happened. We also introduce the generation that's up and coming that will enter the workplace this year in 2025, and that's the Alpha generation. We talk about the different traits and beliefs and life experience that mark each generation. communication that influence how they work, how they communicate, how they respond to change. We examine the different distinct communication styles, and we also discuss the different stereotypes and biases around the different generational perspectives. We leverage this section of the program to also bring in diversity, equity, and inclusion, and highlight that regardless of the age, regardless of differences, no matter which generation you come from, all workers want to feel safe, included, and valued, and that sense of belonging, which really does equal psychological safety. This segues into a discussion around what workers are looking for in an employer, and we've tapped into Talent LMS and looked at the top 15 things workers are looking for. And we really talk about this with the group, and we talk about workers are looking for socially responsible workplaces that value physically and socially safe work environments. There is a zero tolerance for toxic culture, workplace harassment, violence, bullying. We talk about the importance of recognition and rewards and meaningful recognition, clear leadership expectations, and really tie it back to the CSA standard as well. And then we bring in some various stats on investing in diversity, equity, inclusion. We've got some different studies that we've referenced, a 2.3 times % higher cash flow that comes per employee. That comes from a Deloitte study, 19% increase in revenue, Boston Consulting Group study. So we really tie back the cost benefit of investing in diversity and inclusion and psychologically safe workplaces. Section 4, it's a little bit drier in this section, but it's really, really important information because we explore all the various Ontario legislation that applies to psychological safety. We stress the importance of knowing where to find this information. We really touch on the fact that we don't expect you to be able to give us this information back verbatim, but you need to know what applies to you in your work environment. So we talk about the Ontario Human Rights Code, we talk about the Workplace Safety and Insurance Act, we talk about the accessibility for Ontarians with disabilities, and we talk about the Occupational Health and Safety Act as well as employment standards. And then we tied that back to the policies, procedures, and benefits and resources that the employer has. And we have a really robust discussion on what's available and knowing what's available in your community, as well as tying into those resources that the employer has. We've recognized that doing a lot of this work that, a larger scale employee may have great resources, great EAP program, they have people you can talk to and you can tap in, but smaller firms don't necessarily have those resources. So we really have to tie back to what's available from a community perspective. We've also talked about in this particular section in 2018, the Workplace Safety and Insurance Act instituted entitlement for compensatable claim, potential entitlement for work-related stress. So we tie that back into this as well, and we talk about examples of what could be considered compensatable from a stress perspective. Examples could be being subjected to harassment, being subjected to bullying, witnessing a fatality or horrific event as examples. And we know and we stress the importance of the employer policies, again, knowing what's there, knowing how to respond, bringing in counselors, so on and so forth, depending on what's happened. Moving on. The next section will move into using the RACE concept, recognize, assess, control, and evaluate. So when we're talking about from a psychological health and safety perspective, we're talking about recognizing the hazards and the effects on the individual and the teams, assessing that impact, and no different than when we're controlling physical hazards, as Jennifer spoke to. We're talking about, controlling and mitigating those hazards, and then evaluating, and following up. And following up takes a little bit of a different tone too. It's not only making sure that we have the right practices and procedures in place, but it's also making sure that we have provisions in place to circle back with our workers and talk to people. In this section, we also examine both qualitative and quantitative demands. When we think about those qualitative, what skill sets does the person have, the deadlines, self-regulation examples, the things that can cause stressors at work, and the quantitative demands, the amount of time, the effort, the accuracy. I know I probably don't need to go on with this group, but these can all create psychosocial risk factors, and we talk about that and we explore the differences. We also explore the differences between Work-related and non-work-related risk factors. So psychological safety is about creating that environment where employees feel safe, they can contribute, they can learn, they can challenge. Just as Jennifer said, we want people to feel comfortable at work and be their authentic self. I'll steal Jennifer's line because it really is important. Psychosocial risk factors, on the other hand, refers to the factors that, when work is hurting, we need to recognize that. We need to recognize when, poor task design or high stress work environments or long hours, those types of things are causing individual stress. Work shouldn't hurt. And through this particular course, we've created a couple different flow charts. I will show you a quick snap chart of those, but these are meant as resources for leaders to sort of walk through if it's work related or not work related. So I'll show you those in the next 2 slides just as a high level overview. And then in this section, we summarize with a slide on how leaders can support a positive organizational culture and create a work environment that supports employee well-being and performance. So just as an example for the flow charts, race against psychological hazards, non-work related. So we have a flow chart, we ask the question as a leader, are you okay? Our job at this point is to listen, ask, as you're listening to the individual talking, you'd be saying, is fit for duty a concern? If no, what's the next step? If you have an EAP program or know what community resources are available, and then check in and monitor with the employee. Non-work related, the individual is not fit for duty. We've created a flow chart to say, okay, same kind of, we're starting with the same preliminary. Are you okay? We're listening actively. Is fit for duty a concern? And it is a concern. So now we're going to engage, maybe the company owner or certainly our HR people. We're going to provide an EAP referral. We're going to tap into those community resources. We're going to examine whether a leave is required. Is modified work an option? Ask the employee to obtain medical evidence. This is really important if we're going to be modifying work or they're going to be away from work. Provide leave from evidence based on the the evidence provided by a licensed medical practitioner, and then ask the worker to keep us informed on the return to work status. Ultimately, when they are ready to return to work, we would want the company or the leaders to obtain medical clearance for the worker to return to work, and then once they're back in the work environment, we're going to monitor and make sure and check in with the worker or the employee and document that we've done that. We've also created a couple other ones that, they flow better when we're delivering the presentation, but work-related, so fit for duty. So work-related risk factor, initiating an assessment, explain any limits of confidentiality, identify potential psychosocial risk factors. In this particular, if it's work-related, work is hurting. So what's happening? What is within the leader's control? Is it workload? Is it inclusion? Is it working alone? Is it balance? All of those things. Do the concerns require additional support or investigation or intervention? We really want to stress the point that we're not treating physical safety and psychological safety any different here. We would do an investigation if somebody's hurt at work physically. We should be doing an investigation if work is hurting someone psychologically. And then seek support from the company owner. Further investigation may be warranted. If the worker is fit for duty, again, provide support, resources, check in and monitor. If they're not fit for duty, basically, start with a similar process. We're going to ask worker to obtain medical documentation. In Ontario, we have what's called a Form 7 report that would have to be submitted. So we would submit the Form 7 report, again, obtain those restrictions, work with the worker, internal staff, and coordinate a leave and or offer modified work based on those restrictions, and then monitor and follow up and document. So these are some examples of some really useful tools that we've embedded into the program that the leaders that take this course walk away with, and we've got some really positive feedback about these tools. We then move on to section number 6. And in this section, we explore talking about mental health openly. We have really great dialogue on stigma and the misconceptions about mental health. We discuss and we have a really good brainstorming session on why workers don't want to speak to supervisors or managers about mental health concerns, and how can a leader encourage communication. And then we introduce what's called the CARE model, and I'll show you a little bit more about that on the next slide. But the CARE model, and we discuss active listening. We talk about the leaders being in a good spot themselves before they have that conversation, and we have that dialogue. Are they in a good headspace? What if a year is really hard to deal with? Do they know what resources are available to help them? And we really drive home that, it's okay not to be okay, but you can't stay stuck there. And leaders are human too. So just because we're leaders doesn't mean that we're not going to have feelings. And we explore all the different tools that are available for the leaders to use as well. It could be one-on-one conversations. There's a variety of resources. We've got the 988 helpline in Ontario. We have Connix Ontario. We have 211 for available health services. So we talk about all of those resources that are available. And then we talk about empathy, compassion, and concern in managing performance, because ultimately we also drive home in this course that one of the jobs that an individual has as a leader and managing as a supervisor is they are responsible to manage performance. And this is part of it. As an example, moving on to the next slide. The show you care. We really introduce the care concept, and that's compassion. So as a leader, you are responsible for checking in on your team of individuals. This is actually your responsibility. Take every precaution reasonable in the circumstances to protect your worker. And it's not any different than any other hazard. We must take every precaution reasonable. If you recognize an individual isn't well, or they're struggling, or what's going on, assess and find out, is this work related or is this non-work related? At all times, we're going to have compassion and empathy, but we really have to know if work is hurting or is this something we need to support the worker differently. We respond to them, and we call this the 4 R's, but we respond by saying thank you for trusting in us. Ask the person what's next for them, because ultimately we all own our own mental health. And so recognizing, that there's information out there, maybe they want to talk to, somebody internally, maybe they want to talk to a close family friend or a counselor, a family physician, but what's next for them? At all times, we stress the importance of document. And if it's work related, we're going to be looking at an investigation. For non-work related, we're going to stress that journal entry. And again, we can tie it back to using those flow charts, but documentation is just as important. When we're looking at psychological health and safety, we're really not treating this any different. So document is part of due diligence. And then the encouragement piece is treat the same as physical injury. Always keep an open door policy, check in with the individual, handle their trust with care and confidentiality. And we talk about the importance of confidentiality. This isn't lunchroom conversation. And then monitor the individual and, of course, the work environment for improvement. The next section, in section 7, this is where we're going to bring everything together. We're going to put it all together, and we use a variety of case studies. I think we have about 10 different ones in total. Those are all based on real life scenarios, and they've been developed from various sectors. So, some from healthcare, some from forestry, some from manufacturing. And we have a variety of different scenarios, and we have the participants in the group work through these case studies, and they dive deep into the psychosocial and psychological risk factors. And is work hurting or is work not hurting? And their goal is to determine how they would support this worker using the care model and discuss each sign, with each sign scenario. And we have them say, okay, what are the psychosocial risk factors? What's the impact on work? And what would those next steps be? And really have them dive deep into what they would do as a leader in that situation. And then we debrief and we talk about the case studies openly and reflect on the resources that are available. They're really great exercises to do. Moving along, this would be an example scenario. I just pulled one from one of the ones that we use as an example. We have a Jill as a supervisor. You've become quite close with Jill. You've noticed lately though that Jill seems down, and typically you have lunch together, but you've noticed that Jill now is eating at her desk. She sits in the dark, the door is closed, doesn't really want to interact with her team. And during your most recent conversation with Jill, she indicates she's not interested in her job right now at all. She's tired of working so many hours, and she's she became a supervisor. No one really cares anyways, and the more work she does, the more this piled on her. So at this point, they would have the scenario, they would work in a pair in teams, and they would identify, the impacts, what's going on with Jill, what are the impacts on work, what are the risk factors, if any, is this psychological, psychosocial, what are the qualitative, quantitative work demands, and then identify that approach and next step. So this is just an example of a scenario we would use. Next, we would conclude the program. At the end of the program, we have a course feedback, of course, but we have a summary of the course. We, throughout the course, have encouraged individuals to create an action plan. And so we have them reflect on their action plan. We recap on all those resources available, and then we conduct a course survey. And it's it helps us improve, of course, and we hear feedback from the participants as well, and they leave again just with a high level knowledge of these are the resources that are available, and we share links to our website to CMHA, the bounce back, all different websites and different resources. I thought I would insert an example of a client testimonial. I did wordsmith it a bit. I took out some of the words around the instructor, but the next slide just pertains to an example of a client testimonial. So, as you see, the knowledge I walked out of this course was life-changing. Of all the courses I've been in, this is for sure one of my favorites that I will carry forward and share what I've learned. Anonymous survey respondent. It's really, really impactful when you see a client testimonial like this, and you know that attending an 8-hour course has really shifted how somebody thinks in their perspective, and they can take the tools that they've received in this course and they've learned about, and they can go back to their workplace and they can make a real difference in their workplace. When it comes to psychological health and safety, we're all responsible. We're all going to have mental health challenges. We're all going to have ups and downs. Life is going to be a roller coaster, and we're all in this together. And so the more we can educate and raise awareness on psychological health and safety and have supports and resources and policies and procedures in place, it's a win-win for everybody because we're all in this together. So that would conclude my presentation today. I would like to say thank you so much for your time today and the opportunity to share this snapshot of this exciting program. And I'd open the floor to any questions.
Well, thank you, Adrian. I'm just seeing if there's any questions coming in the chat. I have not seen any yet, and I don't know if there's any other comments or other questions, but we'll just give a pause for that. And hearing no further comments, I guess, well, sort of looping back in there with Bill and the rest of the group. So I know, thank you everybody for connecting in today. On behalf, thanks both for Adrian and Jennifer's information. And I guess we'll look to hear for any further feedback on this topic, and then as well looking forward to our May session. So I don't know, Bill, if you have, Bill or Tammy, if anything else to share with the group.
Just want to thank everybody for participating. It was a good topic today and some really great presentations. I would like to thank the presenters for doing this for us. And if anybody has any further questions or an ask for a resource, please send an email to Tammy and she will help you get whatever you need.
And we did talk about, for our third share, we wanted to know if you had any topics that you wanted to hear about. If you could send them to us, then we can organize our speakers in regards to that.
Yeah, send any ideas for topics to Tammy as well. And I think we need to find out if we can share these slides, Tammy. Did we already work on that?
We won't be sharing these. There's not a lot of content there, so we'll just specific to sharing. So we will just leave it as is. There'll be a recording of this. It'll be available on social if you want to click it on social and rewatch it.
Yeah, we might be able to share some of the resources that were listed or something like that in separate. Okay. Thank you, Adrian. Thank you, Jennifer, and have a good day, everybody.
Thank you.
Okay, thanks everyone.
Thank you.
Thank you.
Thank you.